Right now, city officials are holding a press conference in Chinatown talking about how the city is preparing in the event of a possible coronavirus outbreak here. So let's listen in.
I'd like to invite Dr. Warren Chin from the Executive Director of the Chinese American Medical Society.
Welcome, everyone. I want to thank Charles B. Wang Community Health Center for hosting this press conference. And happy Lunar New Year to everyone. Now, as cases of coronavirus is growing exponentially in China, with official report over 100 deaths and over 4,600 people infected, and in Hong Kong closing the border by stopping issue individual travel permits from China, this has raised a lot of concern and alarm in our Chinese community. I actually have friends texting me that they are not coming to Chinatown for Lunar New Year celebration, and my daughter telling me that I should wear a mask when I see every single patient. Okay? As the mayor said last week, it's not if, but when that the coronavirus will hit New York. Although there's no confirmed cases yet, there are already cases that are placed in isolation and awaiting test results from CDC. It's inevitable that the Chinese community will most likely to be affected first. Now, the purpose of this press conference is to keep the community informed, updated, and to assure that the city, the Department of Health, the medical and health professional, healthcare centers, and hospitals are prepared, ready, and able to face this challenge, as well as important things to educating the public on taking common sense precautions to mitigate exposure and to wear masks and seek medical attention if you think you've been exposed to or have exposed to members that can have the potential problem to avoid infecting others. At this time, I'm honored to introduce Dr. Alexis Babel, New York City Health Commissioner, who has taken from her very busy schedule, as you can imagine, to share information from Department of Health. Dr. Babel.
If you can move over one way, please. Thank you.
Better?
Thank you.
Okay. Gong Hei Fat Choi. Happy New Year. Happy Lunar New Year. It's a pleasure to be here at this convening, and I was just recalling that when I first started as Health Commissioner, my first stop was here at the Charles B. Wang Center because they are such really a pivotal partner to all of the initiatives that we are doing and the collaborations that we have with the Chinese American community. I want to thank the Chinese American Independent Practice Association. We have worked with them also for the past several years, including initiatives on quality improvement and advancing primary care. And we have also worked with the Chinese American Medical Society on past outbreaks. And so I think this is yet another opportunity for us to show the degree to which we are in strong partnership. And I'm confident that the links that we have built between us will help to protect the health of New Yorkers as we move forward in facing this new novel coronavirus. And so as we share information about where we are, it's important to start by reiterating the fact that we have been saying from the beginning of this response that the current risk to New Yorkers is low and our preparedness is high. And what you see here before you is one of the components that comprise all of our preparedness efforts. And so let me just sort of give a quick overview of the novel coronavirus and what we know thus far and what we do not know. And so, as has been talked about, this is a new strain of a known virus family. It causes a diversity of symptoms that can range from the mild to the very severe. Across the globe, we have seen a fairly dramatic increase in the number of individuals that have been diagnosed with this novel coronavirus that was first identified in early January. To date, there have been 4,567 confirmed cases around the world, primarily in China. and tragically, more than 100 people have died because of this illness. Every day, we are learning new information about this virus, and currently what we do know is that it is transmitted from person to person. From what we see so far in China is that the transmission is almost, I would say, primarily in contacts that live with each other, meaning that it takes prolonged exposure to have the virus transmitted. You may hear various things in different outlets that individuals can transmit while they are asymptomatic. Thus far, the best that we can say is that those reports are anecdotal at best, and that the science has not yet been able to determine whether in fact that actually is the case. And part of the importance of being here and working with our partners is ensuring that we arm New Yorkers with the facts so that they are in the best positions to protect themselves and their families. So there are things that we know and there are things that we don't know. Currently, in terms of the best ways in which New Yorkers can protect themselves, is anyone who has traveled to the Wuhan area in the last 14 days or has come in contact with someone who has traveled to that area and is exhibiting symptoms of fever, cough, shortness of breath, overall malaise, should communicate with their doctor. And that's why it's important for us to be here with the groups of providers that you see before you, because the best line of defense is our front line of defense, and that's the importance of having astute clinicians. So we want New Yorkers to go about their everyday lives, but if they're feeling symptomatic, we want them to seek care as early as possible. First step should be to call your doctor, let them know about your travel and your symptoms. And then on the line of astute physicians and healthcare providers, the important thing is to ensure that all of the protocols that you've drilled with us in terms of how to handle a patient who has a potentially communicable disease are put into action. And that includes, providing masks as these individuals present to your office, or directing them to the nearest emergency room and communicating beforehand and ensuring that we communicate on a regular basis. And so it's key that we continue to have this open communication. And thus far, we have received over 70 calls from providers who have treated patients with influenza-like illnesses and worked with them to determine the best course of action. I am pleased to say that we have had no diagnoses of coronavirus in New York City. There have been no individuals that have risen to the level of even thinking about or collecting specimens to send for diagnosis. And the only way in which we are able to really have that level of certainty is by the collaboration and communication that we have with our clinical partners and having astute New Yorkers. Now, I want to just transition for a minute to talk about what we are seeing, the very, very early stages of here, and that we can use your help on. My experience has been, and this has been borne out in other outbreak situations, is that it's important for us to separate facts from fear and to guard against stigma. There are a lot of things on social media that are, I would say, at best, not rooted in science, and at worst, offensive, demeaning, and bigoted. And it's incumbent on us to remain focused on the facts rather than perpetuating stereotypes about what may be causing this outbreak. And so I want to just reiterate once more that the risk to New Yorkers is low, our preparedness is high, And at this point in time, there is no reason to avoid subways or restaurants or change our daily routine. The important thing is to live your everyday life, stay alert about updates, and check in with your provider if you feel unwell. And again, I can't thank enough the providers that we have around the table who are working with us to ensure that patient education materials are distributed and that we are all focused on accurate information. So thank you.
Thank you. Thank you, Commissioner. At this point, I'd like to invite Mr. Eric Ng, President of CCPA.
Hi, my name is Eric Ng, President of Chinese Consolidated Benevolent Association. Usually, Mayor Bassett and Bloomberg call me Mayor of Chinatown. I represent Chinese community in this area. Unfortunately, last Saturday is the first day of Chinese New Year. Usually, we have a lot of activity, especially social party after the Chinese New Year, especially from Thursday. The party will be still going on. As I know, just Warren and Health Department Commissioner just say that the statistic, and every morning I read the newspaper update. This morning the 106 passed away and found 4,500 cases. The best information for our Chinese if they travel through China, and they will close the border from Thursday. They cannot go to Hong Kong. If you have to come back from China, I hope you have self-dispensers to stay home at least 14 days. That's the best. If you have any symptom, you better call your doctor or you report to the health department and make sure don't blend in the society. That's the only thing you can help the society don't spread out the virus. Okay, thank you.
Thank you, Mr. Ng, the Mayor of Chinatown. Next, I would like to invite Dr. Perry Pong, the Chief Medical Officer of Charles Wang Community Health Center.
We have a lot of doctors here, so I will be brief, but thank you for coming. I think Dr. Barbeau's words are really and should be calming to the community and to the city at large. We are working, we as the health center and as health professionals are working closely with Department of Health, and they are really giving us the guidance that we need. So I really want to, again, reassure our own patients, the public, to please go on as you do, but of course do take prudent precautions, okay? Just like you would advise your teenager or your child, right? Wash your hands after you go out anywhere, right? And if you want to follow the Department of Health guidelines, they would say wash it for 20 seconds and sing happy birthday until you finish. Or use hand sanitizer. Don't touch your eyes, mouth, or nose because now I can transmit anything that was around. And it's not scientifically known whether or not wearing a mask might prevent you from getting infection, just the general public. Of course, if we're seeing a patient who is ill, we've been advised to wear masks and gowns and gloves, but that's really for the person who's sick, fever, coughing, and is ill. So please do not add to fears or panic that I have to wear a mask or I have to go on Amazon and stock up or something like that. That's not helpful. Okay, so really just try to reassure people. We at the health center are taking all precautions. We're cleaning very vigorously all their surfaces and taking travel histories from patients, asking where they've been. And I think this just reinforces what good medical care is and what we should have been doing all along. So I'm sure all the other medical people here have more to say, so I'll keep that brief. But thank you for coming, and I think the tone of this is, we'll see where this goes. More information is coming. A lot of people feeling fear or feeling unease is because of the information that we don't know what's going to happen. We don't know what's happening next. So, stay tuned, but, we have a great medical team here, and I really thank you. Thanks for coming.
Thank you, Dr. Peng. At this point, I'd like to invite Mr. Peter Kook, City Council Member, New York City District 20.
Oh, thank you very much. Yeah, this is a very important topic. That's why I come down from Flushing, and the train is really sluggish. So I'm sorry I'm late. Yeah. So we're here to discuss a very important issue in the Asian American Chinese community, especially. We're here to get the word out. That what our community need to do to know. What we know so far is that we are still learning about the coronavirus. So we must control what is within our power to control. It's important that our community exercise best practice in order to keep ourselves and loved ones safe from infection. Use common sense cleanliness and sanitation techniques. Wash your hands, cover your mouth when you sneeze or cough, and if you have been to Wuhan recently and feel ill, see a doctor immediately. Healthcare officials are advising New Yorkers to go about their daily lives, but be vigilant. Also, be careful with the information you read. There's a lot of unverified information online that we just don't know is true. For the real facts, look to medical providers here today, the Department of Health and the CDC and your own family doctor. We must do our part to reduce the possibility of infection. There's no need to panic, but we should all be very cautious. Just be careful and go on your daily lives. And another thing I want to point out is in the business community, a lot of parties, they cancel. I think some of them is not necessary. We all have to be vigilant, but we don't have to afraid and all stay home and don't go out to the regular parties we're supposed to go. So I just want to let our people, the community know about, be calm, there's no panic, everything is okay in New York City. Thank you.
Thank you, Councilman. At this point, I'd like to invite Dr. Hickman Lee, President of Chinese American Medical Society.
Good afternoon, everyone. My name is Dr. Hickman Lee, and I am the president of the Chinese American Medical Society. In a way, it is good that the 2019 novel coronavirus is making headlines all over the world to alert the providers and the public. This virus can potentially be like MERS and SARS if proper precautions are not taken properly. However, when my patient passed out in my waiting room because she got her RVP, which is the respiratory viral panel, is stated positive for coronavirus NL63, that is a problem. When the media stereotype the Chinese for causing this new coronavirus because they claim that Chinese people eat bats and foxes and things like that, that's bad. When we forget that the 2020 influenza has killed over 6,000 people already in the United States alone, that is our biggest problem. So please keep in mind that coronavirus is really not that dangerous to humans. Unfortunately, there are some coronavirus that are very dangerous, like we remember SARS, right? Severe acute respiratory syndrome. That outbreak happened back in 2002 and 2003, in South China. And we also had the MERS, Middle East Respiratory Syndrome. The outbreak came out during 2012 in Saudi Arabia. And finally, we have the 2019 coronavirus. The numbers are constantly changing, but there are close to 4,000 cases, 106 deaths. There is now more concern because there's a concern about person-to-person transmission of this virus. Worldwide, the disease has reached 16 countries, including the United States. We have confirmed 5 cases of novel virus in the United States, 2 in California, 1 in Arizona, 1 in Washington, and 1 in Illinois. Good news that the WHO, or World Health Organization, has not yet declared that the new coronavirus is a public global health emergency. So that's good news. Nevertheless, the Chinese American Medical Society is following the 2019 coronavirus infection very closely. And we are constantly informing and updating our 1,300 plus CAMS physicians with the latest CDC and New York City Department of Health guidelines. CAMS will continue to provide free public education on how to prevent viral infection to the public. CAMS will continue to work closely with New York City hospitals to prepare for any coronavirus outbreak. CAMS will not rest until this 2019 new coronavirus is contained. Thank you very much.
So I would just like to take the opportunity to emphasize something that the distinguished doctor mentioned and clarify that coronavirus is a part of a family of viruses that includes 7 strains. The 2 strains that have captured worldwide attention in the last several years are SARS and MERS. And the 4 strains that we commonly test for, either in doctor's offices or at the hospital, are 4 strains of coronavirus that are known to cause symptoms consistent with the common cold or mild flu-like symptoms. I want to make sure that we sort of give those bookends of the coronavirus family, and to say that experience so far illustrates that clearly this new novel coronavirus of 2019 is more severe than the 4 common strains that we typically test for in offices and in healthcare systems, but as of yet does not appear to be as fatal as the 2 other strains in that family, which are MERS and SARS. And so that's why we are, as other public health officials around the world, taking this very seriously and ensuring that, again, we share accurate information. We give New Yorkers the tools to take care of themselves and their families, but also contextualize the potential risk. And so right now, just to reiterate, the risk is low and our preparedness is high.
Thank you, Commissioner. Thank you, Dr. Lee. And just make a comment, more people, like Dr. Lee mentioned, more people die from the flu every year, so please do get your flu vaccine. The next speaker I'd like to invite up is Dr. Richard Ng. He's the Medical Director of the Coalition of Asian American IPA.
Good afternoon. My name is Richard Ng. I'm the Medical Director of Coalition of Asian American IPA. So I want to tell you something about our organization, just to demonstrate why it is that we believe that we play an important role in this event. Our organization is composed of just under 1,200 providers, and 686 of them are clinicians. They are the frontline clinicians that will see patients daily. They care for approximately 450,000 patients in New York City. Majority of them are Asian. So we are constantly communicating with our provider, make sure that they update that they have the latest update of the guideline, how to take care of the patient in the clinic. This is not just the clinician or the physician themselves, but also the staff, the front desk people, how would they handle patients with the symptoms. So, and also that we heard a report that some physicians experience that there are many patients that come into their office and ask them to test for the virus. So I think we got a sense that there are people out there that they really worry. And partially, I believe that there's some misinformation out there that is not really based on any facts. And I think our job as our KAIPA organization is to educate the general public as soon as possible and not to create any panic. I think that will be our next steps. That's it.
Thank you, Dr.
Thanks for joining us here as we listen in on a news conference of city health officials in Chinatown, giving us all an update on the city's preparedness in case of an outbreak of the coronavirus here in New York. Here's what we heard over and over during that news conference. Quote, risk is low, preparedness is high here in New York. So far, no confirmed cases in New York City. There are 5 confirmed cases of the coronavirus throughout the United States, but most, if not all of those patients are said to be in good health. They are being kept in quarantine or isolation because the bottom line is the CDC and health officials just don't really know exactly what we're dealing with when it comes to this novel strain of coronavirus. The stats worldwide, 106 deaths, about 4,600 cases. Most of them are in China, so they are advising any New Yorkers, if you have traveled anywhere in China and you come home and you start to feel any of the symptoms, cough, feeling like you have a cold, fever, runny nose, any issues breathing whatsoever, get to your doctor immediately. One of the big unknowns with this virus right now is the incubation period, and the CDC is saying that's one of the biggest challenges because they don't know how long it takes to get symptoms. Some people are reporting 2 days, other people are reporting up to 2 weeks. Another challenge we just heard from this local press conference is the idea that people may be able to transmit this virus when they are asymptomatic, meaning they feel perfectly fine, they have no symptoms. They are saying that most of the transmission so far has been with people who have had prolonged contact with one another, but again, we do know it can be transmitted from person to person. Once again, no cases here in NYC, so no reason right now, they say, to change our way of life. You don't have to avoid the subways. You don't have to avoid any restaurants. And they're also warning against stereotyping and profiling about why this virus is spreading. We'll have continuing coverage on the coronavirus right here on CBSN New York and CBSNewYork.com. And with that, we'll be right back.